Thank you, Ranking Member Burr, for holding this meeting today. We're going to talk about a lot of different parts about what happens to seniors economically. But since we're talking about the Meals on Wheels program, I really do want to come back to this, because what strikes me about this is there is such a profound economic issue here that however else you thought about this thing, for every dollar spent on the Meals on Wheels program, we save $50 in Medicare costs. You know, I don't know many places where you can get a 50-to-1 return on an investment. That's spending $25 a year on meals for seniors across the state will result every $25 in a 1% reduction in the number of seniors who are in low-skilled nursing homes. So this is a profound economic issue. These are investments we make. If we are concerned about the rising costs of Medicare, we have right in front of us an open door on a way to help bring down those costs. So count me in as one of the strong supporters here and one of the people who will be active on this. But I do want to say a second part of this. This is also a profound moral question. The question about helping people retain their independence, how we treat people who have worked and supported themselves all their lives, supported us as children, supported their parents when it was their turn. But most of all, what is our measurement of who we are as a people other than how we treat those who are more vulnerable? And so I see this whole question around Meals on Wheels is the specific, it's a way to focus in on it. But this is a place where good economics merges with the decisions that are right for us as a country, as human beings. And so I want to do everything I can to support the work of this committee, to support your work, so that when you're out there on the front lines, you've got a good partner here in Washington. I think that should be our goal. Thank you, Mr. Chairman. So I'd like to ask about another aspect of the Older Americans Act, and that is we started talking about Social Security, how Social Security provides a safety net to keep people out of poverty, but it's a very modest safety net. And I think we'd all agree that people need pension help to the extent they've got it. If they put any money away during their working years, they need that money in their retirement years. But that managing a pension can be complex. And that part of what the Older Americans Act did was establish a pension counseling and information program, 6 regional projects covering 29 states, so that there's assistance for seniors who are trying to get access to their pensions. Now, one project in particular that I've learned about is one out of Massachusetts. It's the New England Pension Assistance Project at the University of Massachusetts, Boston. And it uses OAA funds in order to help people recover lost pensions. Lost pensions are pensions that people moved during their working years. The company has since changed names, merged with another company, so that people can't find pensions that they may now be eligible for. And it's my understanding from reading your testimony, Ms. Altman, that this project since 1993 has produced about $175 million for about 50,000 of our seniors. And that this is another one that has a great leverage on it. For every dollar that we've spent in costs, seniors have recovered about $8 in pension money. But it's only available in 29 states because there's not enough funding for it now. So the question I have is on this one, if we ended the sequester, if we expanded the program, how much money could we potentially recover for our seniors? Ms. Altman?
Thank you very much for that question. Because this is exactly right. This is another really illustration of how the Older Americans Act works. There is federal money that's leveraged in many ways. First of all, there has to be private, they have to have some foundation grant coverage as well. So these 6 regional offices or counseling projects that cover only half the 29 states, 3/5 of the country, bringing in private money and then getting $8 for every federal dollar spent, as you said. Some of the states that are not covered are states with high numbers of retirees. Florida is not covered. A lot of the Northwest, Washington and Oregon are not covered. Maryland and Virginia are not covered here. And again, I'm used to working with Social Security with the large amounts of money. The money is very modest. It's $1.6 million is the amount to run all of these centers with all of these lawyers handling. They've gotten returns for 50,000 beneficiaries who it's a kind of program integrity. They've earned these benefits and they need legal assistance in actually getting them. I think that if the program were just increased modestly so you could cover all 50 states, we're likely to double the return. So $275 million has been collected for beneficiaries, as I say, a kind of program integrity for the tax expenditures that are used over the course of this program, and I think you could easily double that.
Well, thank you. This is such a modest amount of money, and I just want to emphasize, this is not a subsidy. This is money people earned, and it's just trying to help them get the money they earned. So thank you, Ms. Altman. I want to ask one other question, if I can, about the Meals on Wheels program, Ms. Hollander, and that is, it's my understanding that we've been talking about, you're trying to recover to try to get us to the point where we were in the 1990s, at least, on coverage for Meals on Wheels, but that today fewer than 1 in 10 people who are eligible for Meals on Wheels are actually getting the Meals on Wheels program. Is this right?
I don't know the answer to that.
Okay, so this is what I had read, okay. that the eligibility that we just aren't able to reach. You're nodding, Mr. Downey. We are not able to reach the people who are currently eligible for Meals on Wheels, and this is, as the sequester has made a bad problem worse, but it was not that we were in a good place reaching all of the seniors who needed Meals on Wheels. Is that a fair?
That's absolutely correct, Senator. Before sequester, as I noted, my foot is on the brake in terms of outreach. We don't do outreach. We have more seniors showing up on our doorstep needing meals than we have money to feed them with. So the sequester just we had to slam the brake even harder in terms of what we're doing. And so the challenge is, we know that they're out there, and I don't know if it's 1 in 10, but it's certainly a significant number of folks that should be receiving the services and coming to the congregate meal sites and receiving the ancillary services are not able to do so because programs like mine and the Meals on Wheels programs simply don't have the ability to meet the demand.
So if I can, if the chairman will indulge me for just 1 minute on this, can I ask the question in the other direction? If instead of spending $800 million on the congregate meals programs, we doubled that to $1.6 billion, can you just speak very briefly to the question of both how many people would be helped and how much money we would save by doing that? Whoever would like to jump in first.
Sure. It's going to be significant. I mean, we all know, are painfully aware of the demographics. So we're going to double the number of seniors in this country between today and 2030 who would be eligible for Older Americans Act programs. So your question is very appropriate. If we doubled it, we would simply keep at the level that we're at with that portion that we're currently serving. But in terms of the dollars, it's going to be multiple fold, as I noted in my example with just the one home delivered meal client who saved, if that was $104,000 for the city, that doesn't, we don't know what the Medicare, Medicaid costs were. I mean, the fact is that as a program, we only need to be marginally successful to save a lot of money on the other side. And I would argue that we are highly successful, but that's the point, is that a marginal success is going to break even or do better.
Thank you. And I apologize for running over, Mr. Chairman, and perhaps we can do this more in questions for the record.